Skill number 18 provides catheter care for female. The materials that we will need for this skill is a pair of gloves, a basin that we will fill halfway with warm water, perineal wash, 3 hand towels, 2 barriers, one for the bed and one for the bedside table, a large towel, and an imaginary privacy blanket. Knock knock. Good afternoon, Mrs. Smith. My name is Chris. I'm going to be your nursing assistant today, and I'm here to assist you with catheter care. Is now a good time? I start off by washing my hands, confirming the identity with the wristband, or having the patient repeat their name back to me. I will provide privacy and gather my supplies. I will fill my basin halfway with warm water, checking the temperature with the inside of my wrist. Mrs. Smith, can you please check the temperature with your fingers? Thank you. I will confirm that the wheels on the bed are locked, and I will raise the bed up to my waist level. Prior to touching the patient, I will don on clean gloves. I will take my imaginary privacy blanket and leave it at the foot of the bed to serve as a visual aid. Mrs. Smith, can you please hang on to your privacy blanket while I lower your clean sheet? Next, I will move the opposite arm out of the way straight. Closer arm will flex over the chest. Closer leg, we can either flex the knee or we can cross one foot over the other. Again, it's a matter of personal preference. I'll go ahead and select to flex the knee. Mrs. Smith, on the count of 3, we're going to turn and reach for that guardrail. With 2 points of contact, one hand on the shoulder and one hand on the hip, I will turn my patient. Mrs. Smith, are you ready? 1, 2, 3. After turning the patient, I will expose the area that I'll need to be working with, which is going to be the perineal area. I will place a bed protector or Chuck's pad under the perineum. Mrs. Smith, on the count of 3, can you please turn back towards me? 1, 2, 3. Adjusting the patient back to comfort. At this time, we'll take the imaginary privacy blanket with the gown and roll it inward to expose the area that we need to work with, which is up to the pubis. Next, I will take a towel and drape it across the thighs, but under the catheter. This is additional protection for the bed. Now that my supplies are ready, I can take my first hand towel, submerge it in the water, remove excess. We're going to be using the 4-leaf method here. So 4-leaf method is when you take your hand towel, fold it in half twice, grab it by the corner, and now we have individual leaves or different sides of the wash towel that we can use in order to not cross-contaminate. I will apply perineal wash to 3 leaves. In this instance, we'll need to wash, rinse, and dry the first 4 inches of the catheter closest to the meatus. We will be using a pinching technique with our hand and the towel. Other hand will anchor and pinch the tubing itself closest to the meatus before wiping, so we're not tugging on the bladder directly. First 4 inches away, change our leaf. Hang on to the catheter, first 4 inches away, change my leaf, hold the catheter again, third wipe from closest to the meatus, 4 inches away. Dispose of this into dirty linen. Second hand towel, we will submerge in the basin with water, remove excess. Same technique here. Grabbing the catheter closest to the meatus, wiping and cleaning the first 4 inches, changing our leaf. grabbing the catheter, first 4 inches moving away, changing our leaf, third and final time, grab the catheter, wipe the first 4 inches away. Dispose of this into dirty linen. Third and final towel, we're going to dry the catheter tubing. Same technique here, grabbing the catheter closest to the meatus, drying the first 4 inches, moving away from the meatus, changing our leaf, holding the catheter, drying the first 4 inches away, changing our leaf, holding the catheter, first 4 inches moving away from the meatus. And we're done now. We're going to dispose of this into the dirty linen container. We will remove our towel, rolling it away from us, disposing of it in dirty linen as well, covering the patient back up with the privacy blanket and the gown. And now we need to remove the chucks pad and the privacy blanket. So we're going to turn the patient again, opposite arm out of the way, closer arm across the chest, flexing the closer knee, or crossing the leg over the other. 2 points of contact, shoulder and hip. Mrs. Smith, are you ready to reach for that guardrail? We're going to do it on the count of 3. 1, 2, 3. Turning the patient away from us, rolling the bed protector towards the patient, and removing it. We dispose of this into the trash. Mrs. Smith, turn back towards me now. Very good. Adjusting the patient back to comfort. Last thing here is for us to take our dirty privacy blanket, rolling it down, dirty side towards the inside, away from us, and disposing of it away into the dirty linen. Now that we've disposed of our dirty privacy blanket, we're going to break down our station. We'll take our basin, empty, rinse, and dry, and place it in the dirty supply area. Our perineal wash will go back to its designated area. And our barrier that we use for the table will go into the trash. I will remove my gloves, throw them away in the trash, and I will wash my hands. I can now return to my patient with clean hands and cover the patient back up with their clean sheet. I will make sure that the patient has their signaling device or call light within their reach, directly in their hand. And I will lower the bed back down to its lowest level. I will confirm that the wheels have remained locked. I will remove the privacy, wash my hands, report and document, and my skill is complete.